Even a mild case of COVID-19 can increase a person's risk of cardiovascular problems for at least a year after diagnosis. This according to a new study. Well, that got my attention. Cardiologist Dr. Fahmi Farah joins us on the live line once again. Doctor, thank you for doing this today.
Thank you for having me. It's a pleasure.
So anytime we see a study, we first of all want to talk about the credibility of the study. You've had a chance to take a look at this thing. What are the takeaways, and do we like it?
Yes, it's a very good study. It was done, the patients from Veteran Affairs hospitals, several thousand patients were looked at for this study. So the takeaways of the study is that it is showing that heart disease is very common with people who have contracted COVID-19. And the important thing to know is that it's not just for those who have pre-existing conditions. It's also for those who do not have any pre-existing conditions or risk factors for heart disease, including young folks. And as much as 20 different heart conditions were looked at with COVID-19 patients, and we saw an increase in all 20 conditions as a result of COVID-19, even in those who did not have symptoms during the infection of COVID-19.
Yeah, and some of the big ones, doctor, like heart failure and stroke, were significantly higher in people who had recovered from COVID-19. So I had it. What should I look out for? Is this a conversation I need to start with my primary care physician?
Yes, people should be on the lookout for symptoms, cardiac symptoms, particularly chest pain, shortness of breath. If they're getting more fatigued than before, if they just simply don't have the stamina they used to before, palpitations, dizziness, passing out, all of those, having swelling in their legs.
So if you have somebody that already has heart disease, should you be even more on the concern about this thing?
Yes, those who have pre-existing cardiac conditions are at higher risk of having exacerbation or increased risk of things like heart attack, blockages, heart failure.
The study says for up to a year. So does it then mean that perhaps we're less at risk after a year from this thing? That's kind of weird.
It's hard to say if we're less at risk after a year, but the study looked at the time period of 1 year post, up to 1 year post infection with COVID-19.
We will put the link to the study. As we mentioned, anytime we have conversations about health, it's something you should bring up with either your specialist or your primary care physician moving forward. We'll put that link in the podcast section at woodradio.com. Medical specialist, cardiologist, Dr. Fahmi Farah. Thanks so much for your time today.
Thank you for having me.